So, well, it's 12 o'clock. We've got about 68 people on. Probably more people will be straggling in over time. But out of respect for everyone's time, I'd like to kick this off. And first off, I really want to welcome Chad Towner, CEO of St. Joseph Health System, Trinity Health, who candidly has been just a terrific public servant over the past 8 or 9 months, providing daily updates in writing to our community and providing weekly video conferences, Zoom conferences to make sure everyone was apprised of the situation. You know, I really view Chad as one of our local heroes who has really stepped up. I'm sure people have heard me say, you know, heroes aren't born, they're cornered. Well, Chad was cornered, you know, and he really responded heroically to the situation. And frankly, I'm confident that a lot of the information that he's sharing is helping to save a lot of people. So without further ado, you know, I'd like to pass it over to Chad, and he can kind of open it up and share his perspective of our current situation.
Thank you. All right, so good morning, everyone. So Chad Towner, as CEO of St. Joseph Health System, my direct responsibilities are the hospital in Mishawaka, the hospital that we have in Plymouth, as well as the clinics that we have throughout the region. We've got about 2,400 employees here locally, but we're part of a much bigger system, which is actually the third largest hospital system in the country, called Trinity Health. It's based out of a community near Detroit, but through Trinity, we have 92 hospitals in 22 states. And so going back to March, when the pandemic was just getting started, I was beginning to get daily updates. And that's where David and I first actually you were one of the first ones I talked to, David, about when we pulled the schools and the colleges and universities together. And the questions that came up is, how bad could this really get? And that was back on the 6th of March, I think it was. And it got bad quick in other parts of the country, but around here we did really good. There was a lot of talk about how do we flatten the curve. So I'm going to talk about that a little bit. But what this conversation is, my guess is we're going to have about 25, 30 minutes of a slide deck I'm going to take you through that's going to show you some pretty sobering statistics. We're looking at national numbers, but then how does it drill down to the state of Indiana? How does it drill down to St. Joe, Marshall, Elkhart counties, a little bit up into Michigan as well? And then what's really important that I need you to understand is what's happening here in our hospital. And this is not good news that I'm going to be sharing. There's some really tough things that I need to discuss with you. And I hope that the way it's presented, it's in such a way that it's going to be an eye-opening experience. I've done several of these this week. And what I keep hearing over and over is, I didn't realize it was this bad. And so there's a lot of you that probably still don't know anyone that's had COVID or that's been hospitalized or that has unfortunately died from this. And what I'm telling you is that over the course of the next couple of weeks, that's going to change fast. No matter where you are in the country, no matter where your loved ones are in the country, this is really becoming a very serious situation, dangerous situation in a lot of parts of the country. So without further ado, really looking at who I am and what I do and my role. So as president of the Indiana region for Trinity, the green states are the 22 that I mentioned. So you can see there, we have hospitals in Albany, New York, and Fort Lauderdale, and Fresno, California, Boise, Idaho, Chicago. A lot of you have heard of Loyola in Chicago. That's one of our sister facilities. The importance of that is, as things have been developing in all those other states, I've got firsthand knowledge every morning where I'm getting briefings from them on what are they experiencing. So we've been able to be out way ahead here in the community, and I really do believe that we've saved lives. We've, through the messaging and making sure people are informed, and we really did flatten the curve. But that's over, and the curve is now, instead of flat, it is going vertical. And when you look at all those states, and this is typically a slide that I don't share, but because the importance of it, this is an internal document, internal epidemiologists that are looking at our system of care. So again, going back to Trinity and all these sites, right now the two worst states out of 22 is Iowa and Indiana. And looking back on November 6th, you'll see the top 5 there that were highest risk. We're number 5. Well, if you look at where we were yesterday, we're still number 5, but added to that is Chicago. So when you start thinking about how close we are to Chicago, and we got a lot of people that live in Northwest Indiana that then travel into the cities, I think we have a double whammy here, where with the state of Indiana is already getting hit pretty hard, but it's coming fast from Wisconsin through Chicago, and we've got an even bigger wave coming at us. So this is looking at from the United States and the national daily change of new cases. And so all the way back into early March, you'll see where it picked up just a little bit, then it flattened out until about June 20th, then it started picking up again, and then it even dropped down towards about Labor Day, and then it's taken off from there. So these are new daily cases, and if you look, we actually exceeded 150,000 new cases across the country, and that really is a conservative number because not everybody's getting tested. And so that's just the ones we know about. So I'm going to take you through about 6 or 7 slides. It's just showing a progression of how it has evolved over the country since June 24th. So this first one, and all those little boxes, those are individual counties. And the darker the shade of red, the more prevalent the confirmed cases are. So you'll see there, the darker the shade, it's active cases per 100,000, which is a way to try to, you got some counties with a lot of people, you got some that don't have a lot of people. And so this is a way to get kind of a per capita calculation. So check out what happens here. So June 24, August 3rd, September 28th, October 12th, things start really picking up in the Dakotas and in Wisconsin. So look what happens around Green Bay, Wisconsin. November 2nd, November 9, November 13th. And so it is this groundswell of just a massive amount of new cases. Now, the good news is there is a very high percentage of people that do well with this. They are able to recover at home. They're able to do okay without needing a hospital bed. And there is no treatment. There is no cure for this. So it's up to your body and the immune system to fight it. And so what ends up happening is if you have an exposure today, it's going to take about 5 or 6 days before your body has enough virus that it can even be detected. And this is a very important point because if some of you get exposed to someone that you believe is positive tonight, if you run out and get a test tomorrow, I guarantee it 100% it's going to be negative. Because it's going to take 5 or 6 days for most people before you have enough virus in your nose for that to be detected. Then, depending on your body and how you're reacting to it, it might be, for some people, especially in the elderly or those that are immunocompromised, somebody battling cancer, somebody that's diabetic, smokers, vapors, people that are at high risk end up in the hospital faster than someone that doesn't do those things. But there's no predictability on who's going to be hospitalized and who isn't. And early on, we were seeing about 14% of the people positive were ending up hospitalized sometime in the first couple of weeks. And I'm going to be sharing with you in a little bit. Keep that number in mind. I said 14. I'm going to tell you how that's changed just in the past month here in this region. You hear a lot about what's going on in the national news and the numbers and these big scary numbers, but what does 10 million cases really mean? It's hard to make that real for what the impact is here locally. So I see the national numbers, but I really don't pay a lot of attention to it because I'm more interested in what's going on here in our neighborhood. So same type of thing, the next 5 slides is a progression of what's happened, and that pin drop is in St. Joe County. So for those of you, if any of you live in Michigan, I'm showing you here the Cass, Berrien, and St. Joe counties in Michigan as well. So September 28th, again, the lighter the shade, the better, the darker the shade, the worse it is. October 12, October 27, November 2nd, November 12th. So just visually speaking, that shows you these are new cases. These are not hospitalized cases. Because keep in mind, there's only about 14% that end up hospitalized. But we have that's 14% of a number that keeps getting bigger and bigger and bigger. So David mentioned the daily updates that I've been doing. I actually started back March 19th, and I've done 215 of these, I think it is. And one of the most important things we're doing with that is showing what is the county breakdown here in our service area. So I would assume most of you live in one of the counties that's represented here on the screen. So let's just take St. Joe County, for example. And this is what I shared in last night's report. But what I want to do is I want to take us back to September 30. And if you look at column H, that shows us the per capita, which is what was reflecting the changes in the shading on that red on those maps. But before I show you what those numbers are changing, the rest of this chart, it shows you the population by county in column B, the number of deaths in column C, the number of cumulative cases. The cumulative cases here on September 30th for St. Joe, there was 6,763 people that have had it. And most of them have recovered. What's important for you all to understand, though, is we're beginning to see repeats, people that are getting it a second time. And at least what I'm hearing anecdotally, and there's no scientific basis on this yet, but what we're seeing anecdotally is that people that had a very mild case of COVID, say back in May, and they recovered, now it's coming back with a vengeance, and they've got it a second time, and it's far worse. We're seeing people that recovered from it, especially younger folks that are in their 20s, which is a lot of you or people that you're around a lot. People in their 20s may have recovered, but the after effects later down the road, they're developing blood clots. And why is it that a 23-year-old is dying of a stroke? Why is it a 26-year-old is ending up with massive blood clots in their hands, where their hands change colors and they're losing function of their fingers? And it's a remnant of the COVID disease. We have people that are ending up with blood clots in their kidneys, their liver, and then even sudden death heart attacks. And these are small numbers, small percentages, and some people have said it's roughly 2% that end up with a very serious, if not deadly case of COVID. But as that 2% of what? And as that case number continues to climb, that death number is going to climb. So September 30th, when you look at then the number of new cases that day, St. Joe had 84. And when you see 896 active cases, that means in a 14-day window of time, that's how many people have new diagnosis. And if we look at it as 896 people in St. Joe County on that day were contagious or potentially contagious that we know about. Then the per capita number, and then that red 17 is how that per capita number changed from the previous day. So that's a way to show us then on the spark line how fast is this thing growing. So this really has become our epidemiology, and it's also helping us when we're doing our tracing and trying to figure out which county has a hot zone. Everybody's hot now. So September 30, check out what happens to that 333. It then goes to 495 a couple weeks later. 2 more weeks later, 574. Look what's happening in Elkhart. Elkhart's 798. Just before that, it was 478. So now we're going back to November 12, and we got 4 counties that are north of 1,000. When we were at 100 per 100,000, that's when hospitals everywhere were saying, man, this is widespread. We really should consider restrictions for visitors. We need to protect our staff. We need to protect our personal protective equipment. We've blown way past that. And so now in this region, our average is about 1,000 per 100,000, which translates to 1 in 100 for simple math. So looking at the state, what the governor announced a couple of days ago is changes to restrictions. So in St. Joe County, they deemed us an orange county, an orange status county. So the weekly score, using the terms at the top there, 2 and 2.5, that is calculated by the weekly cases per 100,000, which in our case, it was more than 200. So we had a 3 for that. And then the average of 3 plus whatever the daily positivity rate is, which for us, the county is showing 8%. So we have a 1 there. So the average of 3 and 1 is 2, which is why we're orange. The reason I share that is because I believe we're not really orange. The reality is we're actually a red county in St. Joe and Marshall and Elkhart. And specifically in St. Joe, if you think about the thousands of tests that Notre Dame in particular is doing on students, those end up in the negative cases and the positivity rate is pulled down. If you look at just the testing that St. Joseph Health System is doing, and we've done close to 50,000 tests now, our testing positivity rate is hovering around 20%. And there are some days that it's up to 28%. So as Notre Dame stops doing testing on students over the next couple of weeks as people go home, our positivity rate is going to explode. And sometime in the next 2 weeks, we will absolutely be a red simply because those numbers are not getting pulled down. So probably way more information a lot of you need to know, but you need to know some of the background on what's evolving, because the governor is using this status of orange to determine the crowd size that's allowed in the county. So those 9, I think there's 9 counties that are red, he lowered them to no crowds larger than 25 starting tomorrow. The orange counties, no crowds larger than 50 starting tomorrow. So stay tuned. I think it's going to change for us next Wednesday. When you look at the state, the districts are broken down, and we are clearly in District 2. And when you look at statewide numbers, I want to have you look at the top left there. These are cumulative cases, new cases, across the state since March. That bright orange line that's trying to get a, see if I can get a pointer here. There we go. This right here shows where we had a record day in the state yesterday. We had 6,650, I think it was, cases. The day before was a record, and it was 5,085. So we had a 31% increase in new cases yesterday across the state. Look what's happening with deaths. Early on, there was a lot of deaths in Indianapolis in particular. Big spike you'll see in the next slide. I'll show you here in our district, we didn't have this big death curve in the beginning. Flattened out, but now across the state, we're starting to climb. Across the state, the highest prevalence age group is 20 to 29. And then I'm showing you here test positivity rate, which I don't really put a lot of faith in it. And then people say, well, you do more tests, you're going to have more positives. If you look at the exponential curve here, you don't have the same exponential curve in the number of tests. So we are clearly in a far more serious situation here. This is District 2. So again, these are the counties in north central Indiana that you see there, District 2. Also a record day yesterday. We had a 37% increase day over day in cases, which means we're doubling every 3 days. Look at our death curve that's starting to climb, but this is a lagging indicator that's actually 3 to 4 weeks after the infection. So this big, huge spike that we're seeing, we're going to see this at a very rapid vertical climb in deaths in the coming weeks. So let me say that again. We're going to see a very rapid increase of deaths in our district in the next couple of weeks.
So Chad, one question about that. You know, you highlighted the fact that the 20 to 29-year-olds seem to be, obviously getting an increase in infection rates, but they've historically had relatively lower death rates than the elderly. So as you know, to follow up on your statement about we're going to see this increase, is it going to be mitigated somewhat by the fact that the average age of people getting infected is lower?
So it's a great question, and let me answer it in a couple of different ways. So first of all, we've been seeing throughout the pandemic, our average age for hospitalization has been in the 70s. We have had some days recently where that number's dropped down into the 50s. So we are seeing a younger age of hospitalized patient. We have a 32-year-old in the building right now, and I think we've got one in the 20s, but there's a young 30s that is very serious. And so when we start thinking about, we have no predictable way of knowing that, I'm 47, I think, I'm 47. So the difference between me and somebody else, what am I allergic to? What is my past medical history? Have I had pneumonia before? Do I smoke? Do I vape? Do I have diabetes? Do I have high blood pressure? There's a lot of things that go into it that regardless of your age, are you high risk? And so you are right that the deaths have been significantly in the age groups north of 60, which should shake some of you because you're over 60. It is definitely a high percentage for those over 80. But what's been tricky is we've seen outbreaks. So in our county, we've had 6 nursing homes with a significant outbreak in the last month and a half. And there's a lot of those folks that are in their 70s, 80s, 90s in a nursing home that never make it to the hospital because they've already decided, if I get sick, COVID or not, I'm a no-code patient, and I'm going to stay here and live my life and die in the nursing home. So we're actually seeing, even though you're hearing of outbreaks in the nursing homes, there might be 50 people positive, but only 8 of them might potentially go to the hospital. So the other thing that's scary here, and I'm sorry to give you some of these scary thoughts, but we got to be thinking about this, is we're also seeing an increase of non-COVID patients in our emergency department because 42% reduction of ER visits this summer because people were afraid to go to the hospital. They were afraid to go to their doctor. So we're having more people show up dead on arrival from heart attacks that should have not have died. And as the hospitals fill up, and we are full, Beacon is full, Goshen is full, Woodlawn is full. You name any of the hospitals in the region, our COVID units are beyond capacity today, and we're starting to take beds out of the non-COVID units because we're having to focus more on COVID, which means we're weeks, if not days away from having patients die in the emergency department that can't get upstairs to an ICU bed because we don't have a bed. And that is the most important message I need you all to hear me and trust and believe that this is real here in our community, that we're at a point that the hospitals are beyond capacity. And so the next several slides I'm going to be showing you is really what does that mean? And look at what happened here. And Brianna and I, 20 minutes ago, were kind of talking about what happened after the game. Game was great. Everybody's jumping and screaming, and I was in my living room jumping and screaming. And then it was, oh my God, no, because look what happened. It ended up being an 8,000 person mosh pit on the 50-yard line. Now, high percentage of those had already tested negative in the week, and we are hopeful that there's not a big prevalence that's going to come out of this. But even if there's 50 people in that pile, how many people, if you put your arms in both directions, how many people can you touch in a mosh pit like that in 3 to 6 feet in any direction? And they're yelling and screaming and breathing out. The image that I want you to think about is in the dead of winter when it's really cold outside and you breathe and you see that fog come out of your mouth, those are water droplets that have crystallized because it's so cold. The COVID virus is in those water droplets. So you see it when it's cold outside and how far your breath goes. But right now, sitting where you are, your breath is doing that same thing. And those viral particles are in the droplets that's coming out of your mouth, which is why we say a 6-foot distance is safe, because if I cough, if I sneeze, it's going to project that 6 feet. Even just general casual conversation could be 3 feet. So by having the mask, that's containing it. If both people are wearing a mask, it's now contained on both sides. And a lot of people in that pile have a mask on, but there's a lot of people that don't. And then the pictures on the bottom, those are the celebrations last weekend for President-elect Biden. People are dancing in the street and sharing bottles of champagne. I am very concerned of what is going to absolutely explode across the country this week with new cases that came from celebrations last weekend. And back to the timeline of 5 to 6 days before you get a positive test, it's then another week to 10 days before the people that are going to be hospitalized have an inflammatory explosion in their body and they can't breathe. And so it's about a 2-week window after infection that a lot of people are ending up hospitalized. So as you see all these case rates climb, and so this is looking at a series of dates. Let's just get to where we are today. Elkhart County had 1,600 per 100,000 yesterday. And these are new cases, which means in 2 weeks, a certain percentage of those people are going to need a hospital bed. And this is St. Joe Health System's picture. So we flattened the curve and we did real good with hospitalizations for COVID. There were 10 to 26 from April to August, and those were manageable numbers with what we have. because at the time I had a surge capacity of 46 beds carved out just for a locked COVID unit. 46. We blew past that in October, so we went to phase 2 of our COVID plan, which pulled away non-COVID beds, so I can't take care of as many heart attacks, and we increased it to 70. We blew past that. We're now in phase 3, so I have 91 beds between Mishawaka and Plymouth. And I could show you the same graph for Beacon, the same graph for Goshen and other hospitals. We've all gone into multiple phases. And as these new cases come, 2 weeks from now, we're going to need more. So when I mentioned yesterday, we had a 37% increase in this county. What I also need to tell you is we are going to need over 200 beds on Thanksgiving Day for the cases that turned positive yesterday. We're going to need 200 beds on Friday, Black Friday after Thanksgiving for the new cases that turn positive today. This is the scary Armageddon, I hope I'm wrong, death curve that we're already into that wave. The cases are already there and the math is not good. Some people are saying, well, we decreased our bed count yesterday by 8. So instead of 80, we're down to 72. That number is back up into the 80s already today. So the red line is our positive patients. The good news I can share here, I want to give you some good news. Our ICU patients are only 11. So early on, we were very concerned about our ICU, but I've only got 25 ICU beds total for anything, COVID, heart attacks, and others. So what happens when we get to 26? Then we're holding those in the ER or transferring them to Chicago. But we can't do that because Chicago's full. Well, transfer them to Fort Wayne. Can't do that. Fort Wayne's full. So as the whole region is dark shades of red, we're not going to be able to transfer people out. We're going to be holding them in the ED, which means there's a log jam. Ventilators, we've done extremely well with ventilators. Right now, we only have 3 COVID patients on a ventilator. That's because we've learned how to deal with it. We've learned how to try to decrease the inflammatory explosion. The Cytokine Storm is what it's called, where the body is attacking itself because it doesn't recognize this virus and has no idea what it is. And that's where the people end up in double pneumonia on their back, and they literally strangle themselves. They can't breathe because their body is so overwhelmed with fluids. Another visual, the red gold line is hospitalizations here in the community. The dark line there, the black line, is our St. Joe health system numbers. So this is where it was Beacon and St. Joe right here. All of a sudden we get to this, it's those other outlying smaller facilities that are getting overwhelmed. This line, another scary part of this is staff. So I don't normally share this. We're telling enough stories now where, I was on the news a couple of days ago and they said, how many people? And I said, dozens. And that number, it might be 10 today, it might be 40 tomorrow. But one nurse or one surgeon out of service is too many. So for any of you that choose not to wear a mask, think that this is a hoax, think that the distancing doesn't matter and all this is going to go away, what if you're the one that infects a surgeon that has to be quarantined, and how many lives are lost because that surgeon isn't available or that nurse isn't available, that anesthesiologist? We have no idea the people we encounter, what they do. And so the exponential impact of this then becomes when a healthcare worker is knocked out, how many more lives are impacted by that? I could keep showing you the same thing with different images. That blue line is the hospitalizations. Clearly it's increased. I mentioned earlier, 42% decline in our ER visits, which means more people are seeking emergencies because it's been festering and they haven't been taking care of it. Now, more good news. We have the flu starting. We had our first 2 cases of flu in our hospital 2 days ago. And Iowa right now is the only state that's having moderate flu season already showing up. But look at the state of Indiana. We're the other one with a little different, brighter shade. So ironically, Iowa and Indiana, I said at the beginning, are the 2 worst states right now for our company. Iowa is in massive trouble. And it's come into Wisconsin, it's getting into Illinois. We have got to buckle down and be ready for one heck of a December. All right, I mentioned earlier 13, 14% of the people get infected, get hospitalized. So there's a lot of information on this slide, but what I want you to understand is in July, that number 13% of the people known positive needed to spend at least one day in a hospital. Then in September, 16% ended up being in the hospital. Late September, 18% needed a hospital bed. We're at 21% now. So all those people that turned positive yesterday, I need to prepare for 21% of them needing a bed 2 weeks from now on Thanksgiving. That's how I got to that number. So if there's 100 people on this call, 1 out of 100 guaranteed is going to get it, and 1 out of 5 is going to be hospitalized. And the math just isn't adding up here in this community for a good situation. This individual here is the longest living recovered COVID patient, and she spent 47 days in our hospital that I'm aware of. 47 days away from her husband, from her family, because there were no visitors. And every day I'm getting calls from crying family members that just want to be allowed to come in to see their loved one, to hold their hand, to hug them, to kiss them on the cheek. They can't. There's no visitors. There's a lot of talk about vaccine. There's a lot of information on this slide that may or may not make sense to you. The reality is there may be 30 to 40 million doses coming, but it's really only about 15 to 20 million by Christmas time, and those are going to be specifically for healthcare workers, if it's available, and if we can figure out how to distribute it and get it out. What it looks like with Pfizer or Moderna, those are the two that are really in the lead. We're having to prepare for being able to store it at 80 below zero, and we can only open the container twice an hour, and each vial we pull out can only take care of 5 people, and we have to add a little bit of saline, just the right amount, and have it for just the right amount of time, and give it to the person in just the right window of time because the half-life is so short. And then you got to come back in 30 days to get it again. So the people who get their first dose in December, they're going to have to do it again in January, and they're not going to have immunity for another 4 to 6 weeks. That is the reality. And so the additional reality here is everybody on this call, you're looking at probably third quarter calendar year next year before you're even in line, if you choose to take it. So this vaccine, there's a lot of energy. The stock market's going nuts. They're excited about it. The president and others are going nuts. They're excited about it. People are saying this is going to be the turning point. I'm telling you, it's not going to be any impact until next summer, based on the very high level intel that I'm getting that our team's preparing for. So then what other therapies can we do for this? And so there's a lot of information here. And bamlanivimab is, I think how it's pronounced, is, we just call it BAM. Eli Lilly has a monoclonal antibody that I've got a meeting at 2 o'clock today trying to figure out how do I work together with Goshen and Beacon and the health department to have this available, and I might only get 30 doses. And what it is an antibody. This is basically similar to the treatment that President Trump received when he was flown by helicopter to Walter Reed. But which 30 patients get it? And I don't know when I'm going to get the next dose. And there's a window of time that it has to only be given within 2 to 10 days post of symptoms. If we go into day 11 and beyond, it's actually more dangerous for the patient. So there's so much changing with this. And that's why people are getting frustrated. It's like, well, I heard we were getting a vaccine. I heard there was a therapy. I heard, yeah, but we don't know when it's really going to be available. Our team has done an amazing job with our incident command going back into March, and probably can't read a lot of the names there and the different groups, but David, this is something to think about, that within your faculty and the teams and the student leaders, what have you got for structure for a COVID response? And hopefully you have something in place, but if you don't, I'd be happy to help you give some structure to that, if nothing else, for the learning opportunity. Because for most of us on this call, this is not going to be the last novel virus or pandemic that you're going to experience in your lifetime. How can you be even more prepared the next time you face this, especially from an educational standpoint? I think that'd be really interesting to do. The update that he mentioned earlier, this is just a view of that. David, I'm happy with you to share that with anybody. I've got you on the distribution, and if you forward it, we're continuing to do that Monday through Friday, keeping people informed of what's going on here in the region. And then if any of you wake up tomorrow morning and you can't taste your coffee, you got a fever, you've got a cough, and you think, oh my gosh, is this it? What do I do? This is the St. Joe Health System hotline. There's other hotlines in the region, but this is the one I know by heart. If you call that number, and it's only open in window of time, I believe it's from 8 to 4 daily. But what that does is get you in the queue to go to our test site. And yesterday, I think it was 150 people that we tested at our testing location here in Mishawaka. And the other thing that this hotline is doing is helping people that need access to resources. Because we're finding out that when people are told, all right, you're positive, one of the first things they do is they jump in the car and they run to the grocery store because they're going to be quarantined for 2 weeks. Well, what did you just do? You're now exposing everybody. So we're trying to connect people to resources, which could be another interesting thing for your students and faculty, trying to figure out how can you help the community. We need runners. We need people that are healthy, that we connect them with people through the hotline. And we've had this where a mom, a dad, and their 3 kids are quarantined, and they have no family. They got 1 car, but there's no way for them to get to the store. I'm sending my nurses out to buy them groceries when I need that nurse in the hospital. So that could be something that could be a huge community benefit that Ivy Tech certainly plays a part. And let me end with this. So this is George Washington Carver, a quote that someone shared with me. How far you go in life depends on your being tender with the young, compassionate with the aged, sympathetic with the striving, and tolerant of the weak and strong, because someday in your life you will have been all of these. This virus does not discriminate. It doesn't care how old you are. It doesn't care what race you are. It doesn't care how much money you have in the bank. Every single person back in January did not have immunity, and our service area has 1 million people in it. Those 9 counties, 1 million people, and so far only 40,000 have gotten it. So we have 960,000 people that do not have the immunity, and the shot isn't going to be available till really and effective next summer. So people ask me, how bad could this get? It's up to you. It's up to you and what part you play, because every person that chooses to be more serious about the mask, the distancing, washing your hands, and avoiding crowds that could potentially spread this helps. The other suggestion I have for you is think about your vulnerabilities. And how many, if we were to show the Brady Bunch view of all the pictures, how many people are touching their face? How many people are wiping their eyes? Do you wash your hands before and after you put your contacts in or out? Every time you take your glasses off, every time you adjust your mask, you are exposing to your face anything you've touched since the last time you washed your hands. So think about it. How many times did you wash your hands yesterday? Whatever that number is, you do it 5 more times today, because it's on your hands, and the entry point is your eyes, your nose, and your mouth. And every time you shake someone's hand, that's a vulnerability. And there's been a lot of talk about churches lately. Churches are doing great as far as mandating masks and distancing. What I keep hearing, though, is what happens when the priest or pastor or church leader is at the door greeting people, shaking every hand as they walk out the door. They've now exposed every single person on their way to the door. And it's not just churches, it's restaurants and bars. It's any other place that's congregating. And so there's a lot of pressure on what are the restaurants doing? You know, the germs that are on a glass that the waitress takes it back to the kitchen, what are they doing to protect the folks in the kitchen that potentially get it on their hands, then touch their face, and then they touch the next glass or the next plate that's going back out to another table. And this is I don't sleep anymore. This is the neurotic where you got to think about it. And the final thought I'll give you before we open up for questions is, what are you doing for your own immunity? How strong is your immune system? If you smoke or vape, quit today. Quit today. If you are getting 5 hours of sleep, you need more sleep. If you're not getting enough activity, you need more activity. What are you doing as far as your vitamin supplements? Are you getting enough vitamin D, vitamin C? There's a lot of people talking about turmeric and ginger shots and other things that people do, elderberry, and there's a long list of things that people do that are trying to help with boosting their immunity. But think about your nutritional component. What you're putting into your body prepares your body for fighting this virus if you get exposed. So there's not enough talk about nutrition and sleep and activity, and I'd encourage you to be thinking about those things as well. And David, I think that's a really good point to stop, and I can certainly open it up for questions, and I'll pull it off the screen here if you want to see people's faces. So.
Great, thank you very much. This has been eye-opening, and I'm sure there'll be a number of questions. We want to invite people to type them into the chat room. While we're waiting, I'll kick off with one question I have. Chad, you mentioned that one may not experience symptoms for up to 5 days after being exposed. Are they contagious during, how quickly do you become contagious? Are you shedding virus even though you're not potentially experiencing symptoms? And I know that's true for asymptomatic people, but right. and we all wear masks assuming that we're contagious. But sure. Is there any information on that front?
So the advice that we give our employees is after an exposure, we don't know how soon somebody's going to start shedding virus. Some of the research I've read is that younger people, especially small children, will have an infiltration and more exposure and potentially shedding virus faster than you or I. So you figure you got a bigger body, and how fast does it kind of take over? But the kids tend to respond to it faster. Their immune system is stronger and better than ours, especially for things that we've all never seen. So we think that kids can be contagious faster than an adult, but when we hear of employees that get exposed, we're telling them to quarantine immediately. And then you got to quarantine, and then it's that painful waiting period of, okay, wait 5 or 6 days to get the test. And people are anxious. They want to get a test and prove, okay, see, I'm negative. There's a lot of people in this community that have gotten a negative test, and it was too soon. And it was pre-symptomatic. And so the unscientific, this is the advice I give to my family and friends. And I'll share it with you, and that is roughly 5 to 6 days, get the test. But roughly a 48-hour window before that test, you're probably shedding virus if you have it. And you could be contagious up to 14 days. So here's what's interesting about the 14 days is today is day one of a 14-day quarantine for Thanksgiving, which means those of you that are planning to get together with your family, especially households coming together, if you're not quarantining already, whatever you're exposed to today could infect grandma on Thanksgiving Day. Any day between now and then. I heard that one last night. So
yeah, we do have some questions in the chat, and I'll just kind of run through them. The first question I see is, if we want to volunteer to be a runner, who do we contact?
I think it's a great question, and maybe David, you and I can have a conversation offline if there's a way, because I'd really like to do something that can also get some recognition for Ivy Tech. So if that's something that's coordinated through someone on your team, I know Brianna, so whether it's you, Brianna, that to begin with, let's start with that. And Brianna, I'd probably have you connect with Michelle Peters. You probably know Michelle Peters. And let's start with that. And then we will do better to get Brianna a phone number. What I'm planning on actually starting to publish next week is how people can tap into, whether it's helping with runners, or we got people wanting to offer food for our staff. And the problem is we get a bunch of pizzas dropped off at the front door. We can't really do anything with it because we don't know where it's coming from. It's not coordinated. So we are going to do a better job of communicating to the community of how you all can help more. But for now, if Brianna, if you're okay with this, let's have you be a central gatekeeper for that.
Yeah, I know Michelle actually put her email in there. Instead of bombarding her at this point, if you guys will hold off until we kind of coordinate our communications, and I'll send a follow-up email to all faculty, staff, and students, and anybody else who's on this call. So we'll kind of go from there, but that sounds like a great plan. Thank you so much, Chad.
Yep.
Okay, Chad, someone wants to know if our international airport in the South Shoreline make our numbers higher.
Boy, that's a good question. It's certainly a vulnerability, but we've got a lot of people driving in from all counties, and we have people driving out. And so it is so widespread here in the region that I wouldn't necessarily point fingers at the South Shore or the airport. Early on, when you look at how bad things got in New York and Detroit, what I've heard from my reliable sources is that was because those were the international airports getting millions of people coming in from Europe. And so on the West Coast, you hear a lot about China being the source. Well, that's where it came in through Seattle and LA, but what about New York? That was Europe. And so what we experienced, we have a lot of hospitals in the Detroit area, and they were really hit hard back in April. And the belief was the airport was one of the big indicators, or the big infiltration there. I don't think that's necessarily the case now. Now I'm hearing that there's a stay-at-home order yesterday by I think it was the mayor of Chicago, and elected officials in the Chicago area are now telling people next week there's a stay-at-home order, and they've already had a quarantine order of anybody flying in or driving in from Indiana and other areas. And they've been trying to lock down, and they weren't able to really get ahead of it. And so I think we need to think about it as a vulnerability, but we have just as many people driving in. Think about it like pardon the term, and it's starting to get gross, but think about having a P section of the swimming pool. Okay, this is a COVID section of the community. If you live and work in, you live in Elkhart and you work in St. Joe County, you're taking exposure either way. We're all in this together. We have to figure out how to help each other.
Chad, the hotline number you gave, does that apply to those who live in Elkhart County also?
Yes. So when you think about our service area, it's St. Joe, Elkhart, Marshall, and it also gets into Cass, Berrien. We have people from Michigan coming in as well. And if we can't help you, we've got a way to try to connect you with other resources. At one point, 211 was a resource as well in the community. So if there's any of you that are living outside of St. Joe, Elkhart, or Marshall, you might try 211 in the state of Indiana, which is linked in with a lot of the different organizations around the state. United Way is where I was looking for it in my head. So 211 or the 8560 number that I showed you.
I'm just kind of trying to read through here. Okay, so I'm just going to read this. One got positive result in September and had only mild symptoms, mild coughs, and tested again twice in October. It showed negative. Cough improved only once in a while, then coughs returned, so tested again. It came positive. What does that mean? I was worried I may be reinfected. Yeah.
In that short window of time, it's probably not a reinfected. It may have been false negatives. So this is another thing that's really hard for a lot of folks that aren't in medical and behind the scenes of how this all works. And if you go to our test site, you might be on a completely different testing platform if you go to one of the national pharmacy chains in town. So I'll give you this. So I've got a 15-year-old in another community outside of here that's living with her mom. She was sick last week. 3 of her friends positive. Her mom takes her to one of the national chains for pharmacy. They pull up to the drive-through window that we get our meds through. They handed her the swab. And my 15-year-old was then expected to do it herself. So we have specially trained staff at our test site that know how to put it in, at what angle, how far, how long, and then how do you twist it as you pull it out. In that location, they gave it to a 15-year-old and said, here, do it yourself. Zero integrity for the test. And what do you know? She was negative. And so that's a very unfortunate thing. There's a lot of people that they got tested, they think they're okay, so they were either too soon, maybe the integrity of it was bad. I think the quality of the testing has gotten much better. So if they have a good swab, a good sample, whether it's the rapid test or the PCR lab test that the hospitals are doing, the quality has gotten good. So I have good faith in the equipment if they have a good sample. So
Okay.
to really sum up the question, it's possible it was false negatives.
Okay, so on that same line, does the doctor said the virus, they still have the virus. It takes time to go away. So she wants to know, is she still contagious to others? Is she still a risk?
There's a lot of variables with that, and it's hard to answer without knowing more, but let me try to simplify it. For people that are not bad enough to be hospitalized, the CDC, the CDC has changed the guidance a few times as we learn more about it, but one of the thoughts that needs to be clarified by your physician, okay? So don't take this as the medical advice. But there is a school of thought that if you are positive and then you have a period where your fever stops and it's down and you don't need medication to keep it down, that there's a window of time, say 10 days, where you are now not symptomatic, that gets you into a window of time where you're not contagious. But for those who are hospitalized because they've had an inflammatory explosion in their body, all bets are off. And it is a different scenario. So, you know, think about, David, for faculty, especially faculty or students, if you have people that are hospitalized, it is a very different return to work, return to class scenario because of the complexity of their medical condition. As far as how long somebody could have a positive test, there's studies that are showing that people could have a positive test for 2 to 3 months. And it depends on the type of test, because what they're looking for is the remnants of the DNA in the microscopic particles in your nose. So there's a lot of factors that go into that, and I'm sorry I couldn't be more clear.
No, that's fine. Can you tell us how safe air travel really is in this environment?
Well, air travel, I put that up there with even car travel. So if you think about small confined spaces, and so if you're driving your mom to the grocery store, are you wearing a mask? Is she wearing a mask? Because you two are not 6 feet apart and you're in a tight airspace, and even if you have the air conditioning blowing, it's blowing whatever you're breathing out. Think again about those cold winter days, whatever you breathe, that those particles are in your airspace. So that same thing goes on an airplane. That if you're sitting next to someone on an airplane, do you both have a mask? And if the one next to you is coughing and sneezing, can you get a different seat? I think, like a lot of us, the airlines I'm hearing, they're doing a good job sanitizing the airplane between trips, but that's only as good until that first person sneezes. Just like on campus, I'm sure you have environmental services wiping door handles and countertops and other things. That's only good until that first person that sneezes into their hand and goes and opens the door. So it's more about understand your vulnerabilities, whether you're in a plane, a car, sitting in church, sitting in a restaurant, sitting at the dinner table with your family, especially when you have family members coming from other houses. We're seeing a big vulnerability and naivety with people exposing and infecting their family members, because we think we're safe around our family. And unfortunately, family members are passing it to each other.
Are there
David, a quick, I am good beyond 1 o'clock. Do we have a hard stop at 1? What do you want to do as we come up on 5 minutes here?
So we've got people from throughout the community on the call. So if we could keep it open, that would be great. I do know that some people from Ivy Tech do have to drop off for a call from our president. But if you're flexible, we'd love to keep it open.
Yep, certainly am. We can do another 30 minutes if you need to. So you call it. So, Durana, what else have you got?
Are there different strains coming from different places around the world?
Yes. It's a virus, it evolves.
Okay.
And that's going to be really interesting when it comes to vaccines and which vaccine, and is it effective for all people? Think about the flu shot. Those of you that get a flu shot, you get a new one and a booster every year, and every year it's a little different. So what I can't wait to hear, because nobody's talking about it, is this vaccine that comes available in December and maybe available for everybody into the summertime. What happens a year from now? Is it the same vaccine, or are they having to modify it a little bit for how the strain has evolved?
Well,
We don't know.
Chad, if you live in Michigan, can you use the number that was given?
The hotline 574-335-8560 is good in our service areas. So if you live in Cass County, Berrien, or St. Joe, you can, in Michigan, it should help you. Yes.
Thank you. What is the average cost of a COVID test in St. Joseph County? Is the cost causing individuals to not get tested?
Depends on where you go. Some tests are free, some tests are not. And so the urgent cares and the CVS and Walgreens and some doctor's offices that have them available, they're charging for it. And in most cases, insurance is paying for it. But where it gets tricky is you get into the questioning of, do you have symptoms? Do you have a known exposure? Who was the known exposure? If it was ordered by the county health department, that's been tricky. What I can tell you is if you go to the Indiana State Department of Health website, so if you do ISDH COVID, go to that page, and at the very top, it has testing information. It'll tell you all the test sites across the state of Indiana. And it'll show you a map with the county that you can zoom in on a certain spot, and it'll have a phone number, how to get scheduled, and even information about its cost. ISDH and then COVID. Google it, go to that page, and you'll see the information.
And I'll be sure to add some of these resources in the email to our folks as well.
Yep.
Thank you, Brianna. Chad, this person says, I recovered from COVID the end of October. Is there an antibody test that would show whether or not donating blood plasma would be useful? Also, is it possible for me to be a carrier of the virus and transmit further if exposed to a new strain?
Boy, good questions. So is there an antibody test? Yes. Is it widely available? No. And so my best advice on that is check with your physician. Most of the physicians in town should know where people can go and for that test. Where it's a little tricky is early on, Mayo Clinic actually had a national emergency use authorization that let us participate with Mayo Clinic on actually drawing the antibodies and then putting them into the pool for use. I honestly don't know the latest on that, but I know that the South Bend Medical Foundation, which is now LabCorp here in town, you could also call them. That would be the source, not the hospital. And then the carrier, again, it comes back to, we're seeing, depending on how mild your case was, you could be. You could get it a second time. So unfortunately, people get this false sense of safety and security and hope that, well, I had it, I don't need to wear my mask anymore. You don't need to worry about me. I've already had it. No. And it's because you could get it again.
Someone asked, A question. They have a student who was exposed to a family member who just tested positive. She is having a test done today. If it is negative, is she truly negative?
No. And that's the easy answer, and it gets more complicated with, you know, I then ask people, okay, when were you exposed? 5 days ago? All right, well, you might be positive tomorrow. And that's why it's a 14-day quarantine period, because what we have seen globally is people can start exhibiting symptoms somewhere in the 2 days to 14 days. People could have a positive test 2 days to 14 days. On average, what we're seeing and the information we use, it's around 5-6 days is the large majority. Think of that bell-shaped curve. The peak of that bell curve is 6 to 7 days.
Someone wants to ask if the COVID rash itself is contagious.
I have not heard that. This is a respiratory illness that is passed with respiratory droplets. So early on, there was concern that, is this a bloodborne? We have not seen or heard that it is transmitted with blood or other body secretions, but it is respiratory. Then people ask, okay, is this airborne? And this is a confusing topic as well, that if I sneeze, isn't that airborne, that it's being transmitted from me to someone else? But the medical term of airborne is kind of like measles and some other highly contagious where it's in the air and it literally can float for hours. In this case, it's going to float as long as it has momentum, and then it's going to drop to a surface.
Someone asks, is COVID-19 and coronavirus the same thing?
Kind of. COVID-19 is one of the coronaviruses. And so if back in March, if you would have looked at your Lysol cleaning supplies, and it shows all the different viruses and bacteria that it would attack, coronavirus was already on there. Coronavirus has been around, I think, since the 30s. And there's a lot of different types of coronaviruses. And look at the meaning of coronavirus, and it'll tell you as far as what the source is. COVID-19 is the particular strain, the novel COVID-19, which is actually the illness you exhibit after being exposed to the SARS-CoV-2 virus. Way more information, but for you scientific folks, you can take that and dive in a little deeper. So, I
will say I have several more questions, so I'll keep going. But one comment was, this is has been the best presentation that people have been really thoroughly able to understand, not being, STEM people or anything like that. They've really understood your presentation, so that's great.
Good.
Someone wants to know, if you live in Michigan, can you go to the Indiana Health Department, or will you have to go to the Michigan Health Department?
It's best to go through the department of your state. It really is. And that is because then as far as access to resources and contact tracing, but with that said, we have people from Michigan that are coming to our test site because they couldn't get a test. And so most important, we need to know who's positive. And if they're in our service area, we need to know. But it does get confusing when we're crossing state lines. It's already confusing enough crossing county lines. And one thing that's happened with a lot of fluctuation in the numbers that the state reports is that sometimes I might get tested in Marshall County, but I live in St. Joe County. And it might take a week for the state to really reconcile that. So sometimes you'll see some up and down fluctuation in that. That's just noise in the numbers and the variation.
Someone wants to know, is the reinfection associated with new and different strains, or is the problem that there is really no such thing as immunity or herd immunity?
I really can't answer that because we don't know. And so it's possible in both cases, but is it variation of the virus? Is it a mild strain? There's some speculation that even people that have a mild case of it, it's because they had exposure to other coronaviruses and their body already had some T cells built up in their immune system. So I mentioned there's other coronaviruses out there, but this novel virus, our body's never seen it before.
Chad, does Lysol kill COVID-19 strands?
in the case, in the Lysol products that I'm aware of that I have been educated about, yes. But the qualifier there is look at the product. Is it beyond an expiration date? Is, you know, if it's on the Lysol wipes, is it dry wipes that should be wet because you left the container open? I mean, so if it is a quality product inside the manufacturer's guidelines, and then on campus there, hopefully you have MSDS sheets that you're aware of. Just make sure you're checking the products. But simple home cleaning products does kill the virus.
Okay, I think this is my last question right now. If both a husband and a wife were tested positive, do they both quarantine from each other in the car and in the home?
So that's getting into, you know, if you got a husband, wife, even parents and their kids, and you know you have COVID, there's a difference between quarantining and isolation. So if you isolate from the rest of the world because you all have it, you're on probably the same cycle. Where it gets tricky is if mom and dad are positive and the kids have not yet tested positive. Just keep in mind, if dad got it at work and he comes home and infects his spouse, how soon will she have a positive test? 5 or 6 days before she has enough, and then she's waiting 3 or 4 days for a result. So it may be 10 days before the mom even knows she has it in that second wave of the house, and then are the kids in the third wave in the house. So this is really wreaking havoc on a lot of households where you've got people on different time cycles. If dad has it and nobody else has been around him because he's been traveling, he needs to isolate in the house away from everybody else, using a separate bathroom if possible, delivering his food and setting it on the floor outside his door, and really staying clear. But every house is a little different, and that hotline number may be a good resource point because our staff actually helps people through some of those conversations. That same 8560 hotline we talked about earlier.
Chad, those are all the questions I have, but I do want to say that people have been writing in the chat. Thank you for your really presentation and talking to us. Okay, I have one other question that came in. You mentioned that people may have lingering ill effects, and I have heard, hold on. It kind of jumped away from me for a second. And I've heard that even asymptomatic children can incur lung scarring. Is this true?
Yes. Yeah. What we're also hearing, so when even college football, for example, there's a lot of concern, should college football happen? Some conferences chose not to, some chose to play. What I've heard is one of the reasons one of the conferences chose not to is because they saw at least one case of myocarditis developing in a recovered football player. So you imagine some of these linemen, these are big guys. These are 6'3", 300-pound linemen that may be in better shape than any of us on this call, but their body, their BMI and other things that come into play, the way their body reacted to it, they form a heart condition that is dangerous for athletes. And those are sudden death situations on a field if they have a heart attack. Quarterback for Clemson, during the live broadcast against Notre Dame last week, they're talking about the quarterback who has COVID. He wasn't playing, and he had already cleared his quarantine period, but the reason he wasn't playing is because he hadn't passed the cardiac checks, which means he's going to have an echo, he's going to have a stress echo, he's going to have probably ultrasounds and a whole host of other tests to see how is his heart muscle. And that's going to be really interesting to see what happens with professional athletes, college athletes, certainly not happening at the high school level because they don't have the resources. But we're going to see some significant impact on a small number of athletes over the course of the next year. Not everybody, but there's a percentage of them.
Chad, you know, it's interesting, and I think it's important that we kind of focus on this topic of what it means to have recovered from COVID, recognizing that, you know, there have been people who've had double lung transplants that are no longer testing positive, so they're defined as recovered. You know, obviously there can be long-term, you know, physical issues and permanent physical issues as a result of COVID, which is the other reason why, even if you're asymptomatic, and to your point, Chad, you mentioned maybe you're more susceptible, and through a second exposure or third exposure, I think there's got to be this real heightened awareness of the fact that, no one really knows what the long-term impact or effect's going to be on any individual, and it varies drastically. Whether they have pre-existing conditions or not, it's just such a huge unknown that you can't be overcautious. I think it's the message I'm hearing.
Yeah. Yeah. And Dave, just, the audio is, you sound like you're in Canada. Or a robot. Maybe mute it and come back to it. But what some of you may not have heard him say, though, is really talking about, we don't know how your body's going to react to this. And so the people that are really cavalier and just saying, let me catch it and get it over with, bad idea. Anybody that says, oh, let's get to herd immunity, that is a reckless, dangerous, life-threatening idea. Because right now in our community, only 4% of the million people have known to have it. To get to herd immunity, we need to be at 70. So how many thousands of people need to die to get to herd immunity? Because the hospitals can't handle 10 more patients, let alone the 200 that's coming on Thanksgiving Day.
Chad, okay, so I want to clarify from one of the professors. She wants to clarify that the student that we spoke about earlier was exposed last Saturday, informed this Thursday that the family member was positive. She is having a test, but will not have results for 3 to 5 days. When does or should her quarantine start? If she quarantines until her results and is negative, can she return to clinicals?
So the guidance that we use for our employees is the quarantine starts at the point of last exposure. So if you think about that 14-day window, if I was exposed on Thursday, then that would be, then go to the next day to day 1. To start it on the day of the test gives you a pretty solid window that you didn't have any other exposures. But what makes this tricky is, was that the only positive person that she was exposed to? So the quarantine is the last exposure, not the last exposure to that known positive. Who else were they exposed to?
Okay. So Chad, thank you so much. And the one thing else that I want to say is people are really appreciative of your information with us. And some people are already saying they're changing their plans, their holiday plans. And then one question that just came in, are there any new precautionary measures that you would recommend to try to flatten the curve, just enforcing what we know?
Yes. So let me tell you what I do and what my wife and I do. I am trying to get more sleep. I am getting more hydration. I'm getting more fruits and vegetables. I am cutting out fast food and other things that I know are not good for my body. I don't smoke and vape, so I don't have to worry about that. So working on my immune system is one. I am washing my hands or using hand sanitizer constantly, because anything I touch, I'm not grabbing whatever germs are there from anybody else that was there. I am very aware of anybody in my airspace of 6 feet. And if somebody's trying to enter my airspace of 6 feet without a mask, I'm going the other direction. I don't care who you are. And so thinking about those vulnerable positions you're putting yourself into, that's what I'm doing to protect myself, my wife, my kids, and really all of you. Because if I become a vector that then infects one of your family members that I don't even know, who's the weakest link in our family? Who is the one you're trying to protect? We all have one. We all have somebody that has battled and survived cancer or survived a heart attack, or that person that's allergic to peanuts or a bee sting or cats. Think of those really crazy inflammatory anaphylactic reactions that small percentage of the population have. I think those are the ones that are really in trouble with this, because their body already goes on overdrive when they get a bee sting. So know your vulnerabilities, and then the mask works, but the mask isn't the only thing. If all those holes in the Swiss cheese line up and you don't have a mask, you better have good distance. If you don't have a mask and distance, you better be washing your hands and don't touch your face. It all works together.
All right, thank you so
David,
much.
is there any wrap-up comments, anything controversial I said that creates problems for you that you got to deal with?
I'll let you know later. No. Really, this has been fantastic. And we had, over 100 people participate at various times. So I'm confident that there's not a single person who's going to leave this call without telling someone about it. And the fact that it was recorded, we're going to make sure that everyone who's on the call has access to a copy of the recording that they can share. A few people have asked me to see if they can be added to your distribution list for your daily updates. Is that possible? Do you want me to just keep forwarding things to people?
Yeah, and I can't stress enough the importance that the information I shared, that's what I know today, that it could be outdated tomorrow. So with the recording and even some of the things that you heard, you really got to be paying attention to how this is evolving. And that recording could share bad information with somebody next week. So just keep that in mind, please.
All right. Thank you so much for joining us today.
Absolutely. Stay safe, everyone.
Thank you.
Okay.
Take care.
Thank you.